Hi everyone, and welcome to day 2 of Hertford Regional College's Digital Open event. If you'd like to find out more about the courses in this presentation, or any of our other courses, please visit hrc.ac.uk/courses. You can also view all of these presentations again after the event on our Digital Open event webpage. I'd now like to introduce Sharon Edwards, who's going to be talking to you about our Access to Higher Education courses. Sharon, go ahead.
Thanks, Russell. Hi there, everybody. Thank you for coming along this afternoon to our Digital Open event for Access to Higher Education. I'm just going to talk to you this afternoon a little bit about the courses that we offer at Hertford Regional College for our adults in terms of access to higher education. So we have two specific pathways in terms of access to higher education that we run at the college, and they are the access to psychosocial psychology and then the access to nursing and midwifery. So the way these courses work, they are for adults over the age of 19 that have maybe been working in a different sector and have want a career change, or have kind of come out of further education or higher education and are looking to kind of diversify into a different area, or actually have come out of education, have been working, but just want to set themselves up on a different academic pathway. So in terms of the course itself, it is a level 3 qualification that it acts as a stepping stone to a particular higher education course or a higher education pathway. So the qualification itself doesn't give you a license to practice, doesn't give you a qualification in a particular subject as such, but what it does do in terms of, it gives you a qualification in terms of a subject, but not in terms of a career specific vocational area. So those of our students that study the psychosocial psychology are likely to progress into psychology, counselling, youth work, criminology, sociology, or social work. So those, it's kind of the humanities side of higher education. Okay, and our students are very successful in terms of making the transition to both local and national universities. Access is a course that's been, as an academic provider, has been running for a number of years and has been really successful for those people wanting to transition from one career pathway into another. We've then got the nursing to midwifery pathway, and as it says, it kind of does exactly what it says on the tin, really. It gives you that progression route into higher education to study courses such as paediatric, adult nursing, midwifery, mental health nursing, nursing with a special educational needs twist, nursing, a health visitor, physiotherapy as well. We have seen students make the transition into that, along with paramedics and dental practice. So quite a variety of pathway progressions for you once you have achieved your level 3 access qualification. But it is always worth checking out with the university that you wish to progress to as to what, which specific pathway they would recommend. So in terms of our access to higher education courses, they're specifically designed by Gateway, that's the awarding body that we use, in order to prepare you for that next level study at level 4 and level 5. All of our access courses were revalidated and were updated for this academic year. So those of you that are joining us in September, this will be the second year that we've run these new updated pathways. And they've been updated in line with the changes that are happening to the qualifications that you're progressing onto at university, to make sure that what we offer you at level 3 is then mirrored when you then move up to level 4. Okay, you will also receive extensive support in terms of your UCAS application and writing of your personal statement. So for those of you looking to apply and start the access course in September, when you come to us for an interview, you will be asked what university do you want to go to. You'll be asked what course is it that you're going to be applying for at university. And if you don't know that information when you come for your interview, we will actually ask you to go away, prepare that information, and then we will invite you back for a top-up interview to make sure that we've got all of that information, that you're prepared. Because as soon as you hit the ground running in September, we are straight into UCAS applications. And so we need to know where it is your end goal is, where it is you are wanting to progress, so that we can make sure we give you the right advice and guidance, and that we give you the right support, and that we are kind of sending you in the right direction when it comes to writing your personal statement, because it is crucial that, you know, what you write on your personal statement gets read and, you know, gets you noticed. Okay, some of the units that we study as part of the both pathways. So there is a research extended project that we deliver. There's obviously preparation for higher education. There is a section around understanding published research, promoting well-being and resilience. That's a really important unit that we deliver early on in the course, because actually those of you choosing to do the Access to HE, a lot of you will either have children or a family yourself that you are going to still be supporting. You might be working part-time or full-time while still trying to study. So in terms of keeping yourself well, and that's mentally and physically, that's something that is really a challenge when you take on an Access course as well, because you're going to be juggling lots of different balls at once. So we also cover communication around speaking and listening. The reason this is covered in both is because of the pathways that you're going into. There may be a verbal interview, there may be a group interview that you will have to do as part of your application to study at university. So it's really important that we help you develop those skills, so that when you have your interview, you're able to give the best account of yourself. Then in terms of the kind of subject specific pathways and the units and the modules that we teach, so these are not all of them, and there are more, but this is kind of just an overview of kind of the key ones. So there is an introduction to health and disease, antenatal care and the role of the midwife, cells and tissues, mental health and illness, and then circulatory immunity and homeostasis. So we're currently delivering the antenatal care and role of the midwife at the moment, and we've got next week we've got a community midwife coming in, I say virtually, coming into our session to talk about her role and what she does in terms of antenatal care for the mum and for baby, and their role during labour and delivery. So that will be really vital for them in terms of being able to get first-hand experience and reflects that in their written assignment. And then on the psychosocial psychology pathway, we have an introduction to sociology and psychology. We look at poverty and social exclusion, cognitive psychology, and culture and identity. And again, these are very kind of specific pathways that you will be then carrying on and extending into your degree once you move on to university, but they are also kind of heavily focused on what is going on in society at the moment. So in terms of culture and identity, we've done a lot of work around the Black Lives Matter campaign. In terms of poverty and social exclusion, you know, we are using case studies around what's happening in terms of the pandemic. Are people that are living in poverty, you know, they are more likely to be affected negatively by the COVID pandemic in terms of their physical health, but also in terms of their financial health, in terms of their community. So we try to use kind of real life scenarios to help you kind of get that underpinning knowledge, because that's what you are going to be dealing with when you are either at university or once you've got your qualification and you are working out there in the real world in those careers that you've been studying for so long. So in terms of opportunities at Hertford Regional College, we have a full and well-resourced learning centre that you have access to at both campuses. We've got a wide variety of reading materials that you can access either from the library or via ebooks and journals. We have an access-only study area for our adults because we appreciate that, particularly those of you that might have teenagers at home, the last thing you want when you come into college is to be surrounded by yet more teenagers. So we do have an area where you can work privately away from the 16 to 19 students. We have a lot of support from our careers team, particularly in terms of that early on with that application process. In terms of UCAS, it is quite a long process. There's a lot of information that you need to get uploaded and you need to get into your application. So there will be a number of workshops early on in the year to get you started on that process and get you started on that road, because those applications have to be in kind of second week in January, and we want you to be kind of head of the game and make sure that yours are the personal statements that are read first. We do lots of interactive workshops with local universities and professionals. As I've said, we've got a community midwife coming in next week that's going to be talking to our students. We have a midwife that sits on the admissions panel at one of the local universities, and she gives a lot of support to the students in terms of preparing for those interviews. We also have regular tutorials. So you will have a personal tutor who is kind of like your link or lead tutor that you will have regular one-to-ones with, and that's an opportunity for you to discuss your progress, to discuss any kind of issues that you are having in terms of accessing the course, and in terms of kind of any kind of outside social factors that might be influencing your ability to study. What is really important when you come for an interview is that you kind of explain to us kind of where you're at, what your situation is at the moment. If you have caring responsibilities, whether that's children or whether that's relatives or parents, we kind of need to know what you're going to be trying to juggle when you're with us doing access, because we recognise that as an adult, we don't have someone getting us up in the morning and making sure we get to college on time. We don't have someone chasing after us saying, have you done all your homework? We're going to be you're going to have to rely on yourself to do that while still chasing after other people and making sure that they're okay. And if you are still trying to work as well alongside the course, you are going to have to be very good at managing your time, juggling your responsibilities and prioritising kind of work and home life with also the commitment that you make to studying. So it's really important that at interview you communicate that information to us so that we've got a true picture of what you are going to be managing, and that way we can work far more closely with you to ensure that you have the support or flexibility that you might need. I think it's important to say at this stage as well that this year our access course has been delivered completely online this far. We took the decision back in September to move the course over online because a lot of our students were parents or were key workers, and therefore we felt that bringing them into another environment where they were potentially exposed to more people was kind of an unnecessary risk. It also gave those parents who had children, it gave them a little bit more flexibility in terms of childcare, in terms of dropping at school, picking up from school. And so there definitely will be an element of online teaching and learning next academic year, because actually the feedback from the students has been that that's been a real positive. So whilst it won't be all online, because there are practical elements, particularly in the nursing and midwifery pathway, where you have to have access to a lab and you have to carry out experiments, and there are scientific related units that and tasks that you have to complete, there will be elements of where you will be able to study remotely in terms of from your own home or from an alternative environment. In terms of kind of your time, in terms of what you will be required to attend, the current course is run over 2 days. We currently run on a Wednesday and a Friday, and there's no plans to change that at the moment. So if you are looking at kind of childcare arrangements, or you're looking at work arrangements, and you maybe need to reduce your hours or change your working pattern, then the plan very much is to keep it as it is. So you would need to be free on a Wednesday and a Friday from 9 o'clock through until kind of 4 o'clock, maybe 5 o'clock if you've got a tutorial booked with your tutor. So in terms of your commitment, in terms of physically coming into college or physically being online, those 2 days are what you need to keep clear. What you also need to be aware of is that very much like a university course, there is a lot of reading that you need to undertake outside of your hours. So we will do the delivery, we will teach you as much as we can of those units, but there is, you are going to have to take on that responsibility of reading around the subject, of carrying out research, of kind of taking your learning to the next level, very much like you would if, when you come to doing your degree programme. And that's very much how we structure the course, that it is, although it's at level 3, it is very much in line with what you will experience at university, with obviously a little bit more one-to-one support than you will get at university, because we appreciate that for some of you this might be that the first time that you've returned to education for quite a while, and that can be quite a tough transition. So the working pattern and the way that we deliver the course is very similar to the setup at university, but there is far more pastoral support that you can access while you're here with us at the college. I think that's probably about it in terms of the content of the course. What I would say, if you are keen to put an application in, we are currently taking applications for the academic year of September 2021. And those interviews are being carried out on a Thursday morning. So once we have your application, you will receive an email from us inviting you to attend an interview. Those interviews are currently being carried out via Teams, so very similarly to how we're doing today. You will also be asked to complete a written task that you will then have to email back to the member of staff that carries out your interview. And that will give us another opportunity to see what your aspirations are in terms of your progression, and your aspirations in terms of kind of where you see yourself in 5 years' time in terms of your career. So kind of a homework task for you really prior to those interviews is making sure that you're clear about what university progression you're looking at. So what university courses are you looking at? Which are the universities that you think you are likely to attend? And you will need to kind of bring that information with you so that we can start the ball rolling ahead of you coming online with us in September to undertake that UCAS process and get that done as swiftly and as effectively as possible. We do encourage students, particularly on the nursing and midwifery side of things, to get some work experience. And we do have a work experience coordinator that supports our health and social care team that can help if you are struggling to find a place to either volunteer or somewhere that will offer you work experience. Lots of the local NHS trusts have windows of where you can apply to do work experience as a volunteer and as someone looking to progress into an NHS career. So those are often advertised on the government website or on the local NHS trust websites, but obviously we can support you with that. And what that does is just gives you kind of an extra string to your bow, but it also gives you something extra that you can talk about during your personal statement and can give a flavour of the experiences that you've had and the opportunities that you've had and that you're going to be bringing to the university and to the course that you've chosen to study. Obviously, if you are already working in the industry, which some of our students are, so we've got a number of students on our nursing and midwifery programme that are working as healthcare assistants, either in hospitals or in adult care homes, and obviously that's been quite challenging for them, trying to manage working on kind of COVID wards or working with COVID patients alongside juggling their courses. So, you know, we try and offer as much flexibility and as much pastoral support as we can in order to support you with that. So I think that's kind of about all from me. We have got the ability for you to put your questions into the chat, and then I will read those questions out and answer those as best I can. But like I say, we are taking applications. You can do that via the website, and then we will be in contact with you about arranging your interview for the earliest appointment on a Thursday morning that we have. Okay, so over to you with any questions.
Thank you, Sharon. We've had some questions come in already, so feel free to work through those when you get to them.
Okay, lovely, thank you. What proportions of lessons will be online or in person next year? We're still a bit unclear on that at the moment, purely because we're still waiting on guidance from the government. It might be that we do a 50-50 split, or it might be that the nursing students come in slightly more than the psychosocial studies students. But obviously, once you've had your interview and you've accepted your place, we will be keeping in touch with you, and that's something that we will feed back to you as we move through. It is also something that we will consult you on. It's, you know, we absolutely work as a team in terms of the access courses. So we do make sure that that line of communication is open in order to be able to offer the flexibility and work effectively with you. We make sure that we are listening to any concerns that you've got, or any ideas that you've got, or anything that you think will make studying more of a challenge or easier for you. So at the moment, we're not 100% sure. We're looking at a variety of models, but as soon as we've got that, we will share that with you, and we'll also consult you on what you think will work best for you when you're at interview. Yes, we have links with, as I said, Hertford Regional College works very closely with Anglia Ruskin in terms of nursing and midwifery, but also in terms of the University of Hertfordshire. We run a number of level 4 and level 5 courses with them, so we have very good links with them. And then obviously North Middlesex University as well. So yes, we do have those links, and we do have people that we can put you in touch with if that's something that you feel you would benefit from. The cost implications for doing an access course. So if you haven't got an existing level 3, then there is a level 3 entitlement that you can apply for, and that will reduce the cost of your course. If you already have a level 3, then you can apply for an advanced learner loan, and that enables you for the advanced learner loan to then pay for your course fees, and then over the course of that year you pay that back in instalments. What is currently happening is that if you go straight onto a degree course, then the government kind of reimburses you the cost of your access program, so that kind of gets taken off your student loan. Obviously you have to pay it back while you're on the course, but then it gets kind of taken off your student debt that you acquire once you are studying full-time at university. Okay. In terms of what is the latest I would be able to apply for a September start? Ideally, we like people to be signed up by kind of June, just so that then we can get everything in motion. We know our class sizes, we can confirm timetables, we can start the process in terms of the UCAS. But, you know, we appreciate that as an adult, life ebbs and flows, and that things change direction, and you know, you might think, actually no, I'm not able to do that in June, but actually come August, beginning of September, you think, no, actually I do have the capacity to be able to do that. We would still very much encourage you to apply. So we don't actually start teaching until the second week in September, but you know, we do take students after that date if, you know, if things have changed and circumstances have changed and people are able to are able to sign up and are able to commit to the course. So yeah, the sooner you can get your application in, the better. But if life isn't kind of working for you at the moment, don't kind of write it off. Just kind of keep it there in the back of your head. And, you know, if things change and you think that you're now able to cope with that, then please contact us. In terms of class sizes, they really vary. Anything from 8, 10, 15, 20. We're not restricted by class sizes. So, you know, we offer as many places as are needed. So, you know, that's a real positive in terms of kind of access to the course. You don't have to worry about the numbers being capped. We very much work on it. If you have the skills required and if you have the entry requirements that are needed, then, you know, we are able to accommodate that. I would just say in terms of entry requirements for the psychosocial access pathway, you need to have your English GCSE grade C in old money or a grade 4 in the new system. And for the access to nursing and midwifery, you will need to have both your English and maths prior to starting the course. So you need to have a grade 4 or a grade C in both of those. And also, if you are going to go into an NHS career, lots of the pathways now are looking for students to have a science GCSE as well. So it might be that you maybe have to take that alongside your access programme, and that is something that we do run as well at the college in an evening. Okay.
Okay, I think that's all the questions that we've had in for now. We'll just wait another 30 seconds or so, see if we get any more questions.
Thanks, Russell.
Okay, it doesn't look like we have any more questions, so I think we can end the session here.
Thanks ever so much.
No problem. Just like to say thanks to everyone who joined us for this session or throughout the day. As I mentioned before the start of the session, you'll be able to view this presentation again or any of the other presentations from the event from next week on the Digital Open Event webpage. If you'd like to apply, enrolments are open now for September 2021. So please visit hrc.ac.uk/courses and select the course you're interested in to apply. Thank you so much, Sharon.
Thanks. Bye.